Good evening, everybody. I am Dr. Sandeep Agarwal, Senior Consultant, Vascular and Endovascular Surgeon, Institute of Vascular and Endovascular Surgery, Sir Ganga Ram Hospital, New Delhi. I am working in this hospital for last 30 years, which is a very big period. And vascular surgery department, it caters a lot of patients. I would like to today discuss about a condition which is called a silent killer, and which is a problem which is very common. I still remember 30 years back when I started my practice. That time it was told that this problem happens only in the Western countries. It does not happen in India. It is called DVT, Deep Vein Thrombosis. But now there are so many patients who come to us, and if the patient does not come timely, it is very, very fatal and dangerous to the department. So what is DVT? The vein which takes the blood from the foot towards the heart. It is called vein, and it is placed in the leg deeply. It travels with the bone, and when the blood, for any reason, most of the time there is hardly any reason we found, and when this blood is thick, it clots, and in our language we call it thrombus. So the situation is called deep vein thrombosis. So we get a call, Dr. Sahab, I was sitting comfortably, all of a sudden my leg becomes swollen and very painful. The first diagnosis is deep vein thrombosis, because the clot does not allow the blood to go up in the heart. It stays in the leg, and that's why the leg is swollen. It is called deep vein thrombosis. And the risk with this, the clot can jump from the leg into the heart, and from the heart it can go into the lung, which is called pulmonary embolus. Pulmonary means lung, embolus means if the blood clot detaches from the leg and goes into the lung. And it is a very dire emergency, panic situation, and the patient should come directly to the hospital. Patient may have the bleeding from the mouth, patient may have the breathlessness, severe breathlessness, and it should not be confused with the heart attack. So when the patient come to us, we see, we examine, then we do a Doppler test, color Doppler of the limbs. There we find there is hardly any blood flow in the vein. And not every patient is admitted, not every patient is subject to surgery, but these days we have so sophisticated and very technically high machines. We suck the clot from the vein in half an hour or maximum in 1 hour. We suck the clot from the lung. So we try to save most of the patient who come to us timely, and after that the patient is kept on the blood thinner medicine, sometime for 6 months, sometime for 1 year or 2 years. We give the instructions that we will have to change the lifestyle, and this way we can save the patient from the deep vein thrombosis. Thank you.